Basically, malaria is caused by a parasite. It is only transmitted when infected mosquito bite us. And it's spread through a special mosquito, female Anopheles mosquito that bites our blood, and it transmitted to our blood. And the symptoms usually appear after 7 to 10 days, not once you got an insect bite, and you expect that the symptoms should start immediately after mosquito bite. It usually not happen. Symptoms appear after 7 to 10 days of mosquito bite. अच्छा, मलेरिया, डेंगू और टाइफाइड, चिकनगुनिया, उनमें भी सेम सिम्टम्स होते हैं, हाई ग्रेड फीवर होते हैं, और वो भी डेंगू एंड चिकनगुनिया भी आपके मच्छर काटने की वजह से होते हैं, बट वो वायरल डिजीज होते हैं। आपका मलेरिया जो है पैरासाइट इन्फेक्शन है, और टाइफाइड जो वाटर बोर्न डिजीज है, एंड इट्स अ बैक्टीरियल डिजीज। तो अगर हमें पता चल जाए पहले कि इट्स डेंगू और चिकनगुनिया और टाइफाइड है, तो ट्रीटमेंट हम उसके अकॉर्डिंगली हम कर सकते हैं, बिकॉज मलेरिया के हमारे पास ट्रीटमेंट्स अवेलेबल हैं। डेंगू एंड चिकनगुनिया इज वी डोंट हैव एनी स्पेसिफिक ट्रीटमेंट फॉर दैट, तो उसके सिम्टोमेटिक ट्रीटमेंट्स हमें होता है। तो ये बहुत ज़रूरी है कि हमें ये जो हमारे हाई ग्रेड फीवर्स जो भी हैं उनका पता लगाएं कि उसमें हमारा ट्रीटमेंट किस तरफ जाएगा, मलेरिया है या टाइफाइड है या डेंगू है। अब आपको फर्स्ट टाइम जैसे ही आपको हाई ग्रेड फीवर हो, और फीवर विद द चिल्स, इसमें ही सिम्टम्स होते हैं, फीवर विद द चिल्स एंड स्वेटिंग, देन आप डेफिनेटली यू शुड गो फॉर इमीडिएटली यू शुड हैव अ टेस्ट, मलेरिया टेस्ट, रैपिड डायग्नोस्टिक टेस्ट होते हैं, कुछ ब्लड थिन्स होते हैं, वो हमें इमीडिएटली कराना चाहिए, जिसके रिजल्ट जो हमें रैपिड डायग्नोस्टिक टेस्ट हमें लैब पे तो आधे घंटे में रिजल्ट आते हैं, तो इन द डायग्नोस्टिक सेंटर यू विल गेट इन द इवनिंग, बाय द इवनिंग यू विल गेट इफ द टेस्ट डन इन द मॉर्निंग। Malaria, MP serology, we call it MP serology, rapid diagnostic test, and smears, we make it blood smears, slides बनाते हैं, जो slides में हम देखते हैं कि उसमें आपका मलेरिया पैरासाइट्स हैं या नहीं। The first thing is that you should close your windows and apply the nets, whatever the nets is there. Wear full sleeves, as everyone, I think everyone understand and know about that. You should wear full clothes, especially the light color clothes as well, and don't use the things. We should use the thing that prevent the mosquito to come inside our houses, and especially we should not look after our houses to outside our houses, like in the garden area, or we are going outside of the house where mosquito breeds, the water over there, lagging over there, so that there is a best place for the mosquitoes to breed over there. We should avoid those areas as well, and obviously the chemical thing as well while you are applying this net and creams and mosquito repellent, we can use it. And one more thing I would suggest, if you are avoiding for prevention, what you are saying is that if you know that you are going to those areas that are very high in malaria endemic area, we have to take a precautionary medicine, like in Africa and certain parts of other parts as well. There malaria is an endemic over there. We should take before entering to those areas, we have to take the medicine, preventive medicines as well. That is also one of the prevention. Yeah, it is very difficult question, because it depends upon the type of the malaria and how use your symptoms. Usually it takes a week, minimum a week to get it recovered. But if you have a complications of malaria, like jaundice and cerebral malaria, it will take longer than 15 to 20 days. And some particular type of malaria, we have to give a preventive measures, so for 10 to 14 days, so the recurrence will be less. It depends on the type of malaria. When we do the blood test, we'll come to know there's 4 or 5 types of which type of malaria you are having it. The WHO is trying to eradicate the malaria in 2030, and there are lots of, not by saying we can do it, there are lots of efforts are going it, and the 2 to 3 with the education, with the prevention, with the chemical methods, and with through vaccination and awareness, all the programs are going on, and we have to educate the people and the importance of why we have to eradicate the malaria. That is very important, then only we can do it. It is very important. Once the malaria is this, this is a preventable disease. Once even a single bite, if you're thinking one mosquito bite, it doesn't affect me, just a single bite can affect you, and you'll get the disease, this malaria, and it's a very fatal disease. It's you don't know whether you are having a mild symptoms or you have a cerebral malaria or anything. The precaution, I would suggest, the precaution is the one thing that we have to take care of, not for yourself but for the society, not taking care of your home and houses but the surrounding area. That is very important, and to educate your household helps as well, and the other people as well. Those people are also thinking, what happened, nothing is going to happen, just one mosquito bite. But because the poorer are getting more poorer when they are getting ill or they are not getting treatment, all the money are going in the treatment, other thing. So by education and by doing all this precaution and preventions, we can definitely be in the most head of preventing malaria.